Welcome back, everyone, to the Deep Dive. We hear from a lot of our listeners who are either seniors themselves or caring for seniors.
Mm-hmm.
And a topic that comes up a lot is heart health.
Yeah.
So today we're taking a deep dive into practical advice for navigating life with heart failure.
Great topic.
For this one, we're looking at two sources, a Medline Plus encyclopedia entry on heart failure discharge,
Okay.
and a pamphlet from the American Heart Association about living with heart failure.
Sounds good.
So whether you're a senior adjusting to life after a hospital stay, a caregiver looking for some tips, or just generally curious about heart health later in life,
Right.
this deep dive should be really insightful.
It's definitely something that a lot of people face.
Hmm.
And I think one of the things both these sources emphasize is that even though heart failure sounds scary,
Right?
it can be managed really effectively.
It really is about empowerment,
Yeah,
not just reacting to a diagnosis, but really taking charge of your health.
exact.
Maybe before we get into the practical stuff, we should back up a bit. What exactly does it mean to have heart failure?
Well, Medline Plus uses the analogy of your heart being a pump, which I think is a helpful image.
Oh, okay.
So when that pump weakens or has trouble relaxing,
Mm,
it can't circulate that oxygen-rich blood efficiently throughout the body.
okay.
So it's not that the heart stops completely, it's just that it's struggling to keep up with its workload.
That makes sense. And what happens when someone's discharged from the hospital after being treated for heart failure? I imagine that transition can be pretty tough.
Yeah, absolutely. And Medline Plus does a good job of acknowledging that
Mm,
you might be coming home feeling fatigued,
right.
maybe needing help with everyday things.
Yeah.
And there's also the emotional aspect of adjusting to this new reality.
It's a lot to process, both physically and emotionally.
It really is, yeah.
It's almost like having to learn a new way of life.
It is.
But I think the key takeaway from Medline Plus is that those feelings are completely normal and recovery takes time.
Absolutely.
There's no need to rush.
No.
It's like you're retraining your body and mind to work together in this new landscape.
Yeah.
And something that bold sources really emphasize is this idea of self-monitoring.
Mm-hmm.
So it's not just passively taking medication, but it's about being actively involved in your own care.
Absolutely. And Medline Plus has some really practical advice for how to keep tabs on your symptoms at home.
Okay, I'd love to hear about that.
One of the simplest but most effective things they recommend is weighing yourself every morning.
Okay.
And I don't just mean stepping on the scale, but
Right.
actually logging that weight so you can spot any trends.
Because as they point out, rapid weight gain can be a sign that fluid is building up,
Exactly.
which can mean things might be out of balance.
Right.
What other daily checks does Medline Plus recommend?
Well, they talk about paying close attention to your energy levels.
Okay.
Any shortness of breath you might be experiencing
Mm.
it. Swelling in the ankles or ledge, coughing, and
Yeah.
even how well you're sleeping.
It's really about tuning into those subtle signals your body is sending.
It is, yeah.
And if you notice any changes, trying to connect the dots.
Yeah.
Did you have a salty meal recently? Did you miss a dose of medication? I imagine those kinds of clues could be really helpful when you're talking to your doctor.
Exactly.
Speaking of diet, both sources really emphasize watching your sodium intake,
Oh, yeah.
but it can be trickier than it sounds, right?
It can. Medline Plus even points out that a lot of foods that don't taste especially salty
Oh, right?
can still be high in sodium.
It's sneaky.
It is.
So it's about becoming a label detective.
Definitely. And avoiding processed foods and restaurant meals, which
Right.
tend to be sodium bombs.
Yeah.
Even something as simple as choosing fresh or frozen veggies over canned can make a difference.
And speaking of choices, Medline Plus even recommends talking to your doctor about alcohol,
Yeah,
especially if you're used to enjoying a drink on special occasions.
that's right.
It's all about finding out balance between
Yes.
enjoying life and making healthy choices.
Mm-hmm.
Let's talk about medication management.
Okay.
It seems like there are so many different types of medications prescribed for heart failure.
There are.
So understanding what they do and why you're taking them can really help you feel more in control.
I think so.
Both sources mention antiplatelets like aspirin, which help prevent blood clots.
Right.
And then there are anticoagulants,
Uh-huh.
which also thin the blood, like warfarin, also known as Coumadin.
Yes.
And the Medline Plus specifically mentions that if you're on warfarin, you'll need regular blood tests to make sure the dosage is right.
Mm-hmm.
Then there are beta blockers,
Yeah.
which help lower blood pressure and slow down your heart rate
Right.
to kind of ease the strain on your heart.
And of course, we can't forget diuretics.
The water pills.
Exactly. Which help your body get rid of that excess fluid.
It's a lot to keep track of.
It is.
But the key message seems to be follow your doctor's instructions carefully. Ask questions if anything's unclear.
Right.
And don't be afraid to advocate for yourself.
Absolutely. Your healthcare team is there to support you,
Mm-hmm.
but you're the one in the driver's seat.
You're the captain of your own ship.
Yeah.
Now, beyond medication, both sources talk about the importance of making those long-term lifestyle modifications.
Right. It's not about quick fixes. It's
Yeah.
about creating healthy habits that you can sustain.
Sustainable habits, exactly.
And the AA pamphlet really dives deep into what a truly heart-healthy diet looks like.
Oh, okay.
It's not about deprivation. It's about making smart choices.
So what are some of those smart choices?
They recommended a diet that's low in saturated fat, trans fat,
Okay.
sodium, and added sugar.
Right.
It's about focusing on those whole, unprocessed foods like fruits and vegetables, lean protein, and whole grains.
Makes sense. Now, what about exercise? I imagine that can be a little daunting for someone with heart failure.
It can, but the key is to start slow and listen to your body. The AHA actually recommends moderate intensity exercise.
Okay.
So we're not talking about training for a marathon.
Right, of course.
It could be as simple as a brisk walk, gardening, dancing,
Oh, fine.
or even just taking the stairs instead of the elevator.
Yeah, I like that.
The goal is to find something you enjoy that you can stick with.
That makes a lot of sense.
And of course, it's important to talk to your doctor before starting any new exercise program.
Right, because they can help you create a plan that takes into account your individual needs and abilities.
Exactly. And for some people, a structured program like cardiac rehabilitation might be a good option where you get supervised exercise and education about heart health.
It's like having cheerleaders for your heart health.
That's a great way to put it.
I love that.
And I think it's important to remember that managing heart failure isn't just about the physical stuff.
Right.
There's a huge emotional component too.
Yeah, absolutely.
Medline Plus encourages people to be open with their healthcare providers about any stress, sadness, or anxiety they might be experiencing.
It's all connected, isn't it?
It really is.
Addressing those emotional needs is just as important as managing those physical symptoms.
I agree.
Medline Plus even mentioned the possibility of getting a referral to a therapist for extra support. It's about treating the whole person, not just the condition.
Exactly.
And let's not forget the role caregivers play in all of this.
Yeah, caregivers are so important.
It's a real partnership, isn't it?
It is.
Medline Plus even suggests involving family members in understanding the condition and treatment plan.
I think that's a great idea. The more support, the better.
Right, because it could be a lot for one person to handle alone.
It really can.
Now, before we wrap up this part of our deep dive, I think we need to talk about the warning signs that need immediate attention.
Okay.
Both sources have a clear list of red flags that you just shouldn't ignore.
Yeah, so we're talking about things like rapid weight gain, extreme fatigue, dizziness, worsening shortness of breath, chest pain, a persistent cough, swelling in the legs or ankles, and any changes in urination.
Right, the HA pamphlet mentions some even more serious symptoms like coughing up pink, frothy mucus, confusion, and changes in appetite.
Exactly, and if you experience any of those,
Yeah.
it's crucial to seek help right away.
Right, and I think it's always better to err on the side of caution.
It is.
If you're unsure about any symptom, just contact your doctor.
Yeah, I agree.
Well, I think that's a good place to pause for now.
Okay,
We've covered a lot,
we have.
but we're not done yet.
No.
When we come back, we'll delve into the importance of proactive health maintenance
Great.
and explore what it really means to live well with heart failure.
I'm looking forward to it.
Stay tuned.
Okay, so before the break, we were talking about those warning signs, the ones you can't ignore.
Right, those red flags.
Yeah, exactly. Really important.
But it's not just about knowing when to get help right away. It's also about taking steps to stay healthy in the first place.
It's that shift, right, from reactive to proactive.
Exactly.
It's about really taking charge of your well-being. And Midline Plus points out something we should all be doing, no matter how old we are or how healthy we feel.
Okay, what's that?
Vaccinations.
Oh, right, of
They
course.
specifically call out the flu and pneumonia vaccines.
Why are those so important for someone with heart failure?
Well, if you're managing a chronic condition like heart failure,
Yeah.
even a minor illness can really knock you down.
Oh, that makes sense.
So it's about protecting yourself, minimizing those risks.
So you don't have those setbacks.
Right.
Now, what about those regular checkups and blood tests? I know it can be easy to let those slide, especially when you're feeling good.
I know, I get it.
But why are they so important for someone with heart failure?
Well, those visits give your doctor a chance to monitor your condition.
Mm-hmm.
Maybe adjust your medications. Just make sure everything is on track.
It's like a tune-up for your heart.
Exactly.
I like that.
And those blood tests,
Yeah.
they can give a lot of valuable information.
What kind of information?
Well, they can track things like your sodium and potassium levels and how well your kidneys are working.
Right, all important for managing heart failure.
Absolutely.
So it's about being an active participant in your health care.
Yeah, don't be afraid to ask questions,
Cool.
voice your concerns,
Nope.
really work with your medical team.
It's a partnership
It is.
to create a plan that really works for you.
That's right.
We've been talking about all these nuts and bolts of managing heart failure.
Mm-hmm.
But what does it really mean to live well with this condition?
That's a great question.
It's more than just surviving,
It
right?
is. It's about thriving.
Exactly.
And I think both of our sources touch on that.
Okay, how so?
Well, Medline Plus, they focus on those practical tips for daily care,
Right.
recognizing warning sign,
Hmm.
really giving you the tools to navigate life with heart failure.
Like equipping you to
Exactly.
really take control.
Yeah, and the AA pamphlet, they go a bit further talking about those lifestyle changes,
Mhm.
making those healthy habits that stick.
Finding that balance, right?
Exactly.
Managing the condition,
Mm-hmm.
but not letting it stop you from enjoying life.
It's not about giving up things you love.
Right.
It's about adapting,
Yeah.
finding ways to support your heart.
So finding fun ways to be active.
Yeah.
Making delicious meals that are still heart healthy.
Mm-hmm.
And figuring out how to manage stress.
Exactly.
And I think it's important to remember that you're not alone in this.
You're absolutely right.
There are so many resources out there, support groups, online communities, healthcare professionals who really want to help.
And organizations like the American Heart Association.
Yes, they do such great work,
They really do.
raising awareness, funding research,
Mm-hmm.
providing support.
So as we wrap up this part,
Yeah.
I think it's important to leave people with a sense of hope.
Definitely.
Heart failure is serious,
Hmm.
but it doesn't have to define you
Right.
with the right knowledge and support.
Yeah.
You can live a good life.
Absolutely.
It's about taking charge of your health,
Mm.
making healthy choices.
Yes.
Working with your doctor.
It's about finding those moments of joy.
Exactly.
Spending time with loved ones, pursuing a hobby.
Yeah.
Just appreciating a beautiful day.
And it's important to remember that everyone's journey is different.
Oh, that's so true.
What works for one person
Right.
might not work for another.
It's about finding what works for you.
Exactly.
Celebrating those wins along the way.
Now, before we go to the last part of our depth dive, I
Okay.
want to leave you with something to think about.
Okay, I like that.
What's one small step you can take today
Hmm.
to either prioritize your own heart health
Right.
or support a loved one with heart failure?
It's a great question to reflect on.
And for more information, remember you can visit the American Heart Association's website.
Heart.org.
Exactly.
A fantastic resource.
It is.
Now let's take a short break, and when we come back,
Okay.
we'll wrap up our deep dive by looking at the important role caregivers play
Yeah.
and leave you with some final empowering thoughts.
Sounds good.
Welcome back to the deep dive. We've been talking all about managing heart failure, understanding the basics, making those lifestyle changes, and being proactive about your health. And before the break, we were talking about, finding those support systems and celebrating those small victories along the way. But there's one piece of the puzzle I think we need to talk more about. Caregivers.
Oh, absolutely. Caregivers are so important.
They really are.
They're the unsung heroes.
They are. Providing that support, both practical and emotional,
Yeah.
for someone living with heart failure.
And Medline Plus even suggests involving family members in understanding the condition and the treatment plan.
Why is that so important?
Well, the more people who are informed, the stronger that support system is.
Right.
It's about building a team,
I like that.
where everyone's working together towards that same goal.
Absolutely. And I think it's worth repeating one of the key messages from both of our sources. Heart failure is manageable.
It really
It's not a death sentence.
No.
With the right knowledge, the right tools, and the right support,
Yeah.
you can live a full and meaningful life.
Absolutely. It's about focusing on what you could control,
Mm-hmm.
making those healthy choices, and working with your doctor to come up with a plan that works for you.
And finding those support systems, whether it's family, friends, a support group, even an online community.
Right.
Sometimes just connecting with others
Yeah.
who understand what you're going through
Absolutely.
can make a huge difference.
It can.
And I think it's important to remember that every journey is unique.
It is.
What works for one person might not work for another.
Right.
So it's about finding what works for you
That's it.
and celebrating those wins, no matter how small.
Yeah. I love that.
And, as we wrap up this deep dive, I want to leave our listeners with one final thought.
Okay.
You are not alone.
Absolutely not. And remember, even those small steps toward a healthier lifestyle,
Mm-hmm.
they can make a big difference over time.
It's not about being perfect.
No.
It's about progress.
That's right.
Thank you all so much for joining us on this deep dive into practical advice for managing heart failure. We hope you found it helpful and empowering. And for more information, be sure to visit the American Heart Association's website, heart.org. Until next time, take care of yourselves and each other.